Good morning. I'm Rich Bendis, President and CEO of BioHealth Innovation, and one of your hosts for the 7th Annual BioHealth Capital Region Forum. We're extremely excited this year because the quality of the content, panels, and speakers that we have, we think is the best that we've ever had in our 7-year history. We are also, unfortunately, doing a virtual format again this year, which is the 2nd year in a row, as one of our most strategic partners, AstraZeneca, as well as many other companies within our industry, have not permitted large groups of guests to attend their campus at this time. We understand that. And in order for your protection, we believe the virtual format is better than exposing you to some potential COVID-19 variants that someone might have. So we believe the content is not compromised by this virtual nature and hope we will enjoy the format as we go forward. I'd like to thank our organizers who have been working for the last 12 months to plan this event. Joe Sanchez from AstraZeneca, Brian Darmody from AURP, Donna Edmonds from BrainBox, Kalala Eskadanian from Children's National, Aubrey from Emergent. We have Amy Adams from George Mason, Sally Elaine from J-Labs, Uliana from State of Maryland, Department of Commerce, John Newby from Virginia Bio, and the full tailor-made experience team who are our event organizers for the 7th year. Also want to thank our sponsors, of which we have 38 this year, which is amazing. And we really appreciate those who are willing to support this virtual format, because I know many of you would prefer to have it in person, but many of our sponsors have been with us for all 7 years. We appreciate that. Plus, we have some new ones this year. There are too many for me to mention individually, but there is sponsorship information on every one of the sponsors included in our virtual program, which they have information about their companies and programs and services that they may offer. So please look at each of the sponsor sites in the program to see what kind of services, products that they offer within the BioHealth Capital Region. Let's talk a little bit about the logistics for this format. But before I do that, I want to thank our support organizations within the BioHealth Capital Region that hold Virginia, DC, and Maryland together. BHI, Children's National Health System, the Maryland Tech Council, TEDCO, and Virginia Bio. That helps bring the connectivity of this region together by having strong partners in each of the different geographical areas. Now, on to the logistics. We're going to have fantastic speakers, as I mentioned, and panels. Everything is going to be virtual, so that if you miss someone, you'll have a chance to go back and listen or view that panel or that speaker based on its availability. Our digital program includes all the company bios as well as the speaker bios, as I mentioned, so that all of the information on speakers, panels, and companies are contained in our digital program. Today, the official program will close around 2:00 p.m. Also, we have discussion rooms, which are listed in the agenda, which will be available for all attendees to join from 2:15 to 3:15, and there will be various topics and hosts for those different discussion rooms for you to join. Also, there will be open networking for all attendees, and it will be open from 2:00 until 6 p.m. Both audio and video chat rooms will be available for you to communicate with one another and connect in this virtual world. And as I have mentioned, all the panel discussions for the BioHealth Capital Region Forum will be available on the Event Mobi platform until October 6th, 2021. And videos will also be accessible on the BioHealth Innovation YouTube page indefinitely. So you will be able to catch up on anything if you have a conflict in your schedules and can't watch it while it is appearing live on Monday or Tuesday, September 13th or 14th. So with that, let's get on with the forum. Enjoy the fantastic speakers and panels we have lined up for you. As is tradition with the BioHealth Capital Region Forum, and this is our 7th year, we have leaders from the BioHealth Capital Region welcome you to this event, which is a seminal event for our industry. And we always kick it off with one of the key leaders and strong supporters for the BioHealth Capital industry and for the region. And we have Secretary Kelly Schultz, who's the Secretary for the Maryland Department of Commerce, who's going to do our first welcome to all of our attendees, which we think and registrants, which will be over 100 or 1,000. I wish it was 100,000, but it's going to be 1,000 people this year. And so it's a record year for this in a virtual setting, and we can't wait till we go back to live in 2022. So, but with that, Secretary Schultz brings a wealth of knowledge to the Maryland Department of Commerce from her years of experience working in the government, in the private sector, and as a small business owner. She had previously served as the Secretary of the Maryland Department of Labor, and since her confirmation in February of 2015 is also a former member of the Maryland House of Delegates. One of the unique things that she's done in the past year has been a leader and supporter for the location and the headquarters for the new Global Pandemic Prevention and Biodefense Center, which is going to be located in Montgomery County, Maryland. And that's going to be one of the leading pandemic prevention centers in the world. And it's great to have that with all of the other assets we have in the state of Maryland. So with that, Secretary Schultz, welcome to the 7th Annual BioHealth Capital Region Forum.
Gosh, thank you, Rich, so much for the wonderful introduction. And it's so glad to be here today to be able to welcome everybody to the 2021 BioHealth Capital Region Forum. And I too am looking forward to being able to have all of us in person in 2022 for the next forum opportunity. There is an exciting lineup of speakers, as you all know, and panel discussions that are scheduled for the next 2 days. And I want to thank BioHealth Innovation and all of the partners and sponsors for putting this all together. Never has the importance of our region's biohealth cluster, from our private companies to our educational institutions to our government laboratories, been so clear as in the past 2 years. We were all tested by this pandemic, and we showed great strength and resolve. And while the fight against the virus continues, there have been many, many, many victories. Dozens of Maryland companies secured billions of dollars in federal funding to develop vaccines, tests, and therapeutics for COVID-19. This is a testament not only to the strength of our assets and our people, but to our culture of innovation and discovery. We say culture because we know that the life sciences, computer science, cybersecurity, advanced manufacturing, and other disciplines don't exist independently of each other. Advances in one field often spur innovation in other fields, and we must always search for links and connections. One of today's panel discussions is organized by Commerce's Director of BioHealth and Life Sciences, Uliana Desiderio, and Emergent Biosolutions Director of Scientific and Technical Assessments, Audrey Watkins. It is chaired by Eric Stahlberg from the Frederick National Laboratory, and it will explore how computational methods such as artificial intelligence, machine learning, and deep learning can help solve complex problems in health and life sciences. More than 70 Maryland life sciences companies currently use AI and machine learning. We're also a leader in the development of quantum computing, with efforts such as the Laboratory for Physical Sciences, Qubit, Collaboratory, and the Joint Quantum Institute based in the University of Maryland, College Park. Data science can enhance drug development, support physicians as they make complex diagnostic decisions, and make clinical trials more effective. You'll hear more from entrepreneurs who are actually running these companies: Bullfrog AI, Sonova Labs, and Origin Data Sciences. That's sure to be a fascinating discussion for investors and other business leaders in the audience. These connections between disciplines are particularly exciting from an economic development standpoint because they can create new employment opportunities for people with a diverse range of skills and educational background. We're still fighting a misconception that a job in the life sciences or data science requires years of study and research. But the increasing need for people who can code or operate specialized equipment means more entry and mid-level opportunities. You don't need a lab coat or an advanced degree to have a rewarding career in biohealth. Maryland remains committed to supporting our life sciences sector and to our shared goal, making the Capital Region a top 3 biohealth hub of 2023 and beyond. We know that advances and discoveries in one sector can move other industries forward. And what drives innovation in Maryland, DC, or Virginia drives growth for our entire region and indeed the nation. We are all moving forward together. Thank you and enjoy this year's forum. Hope to see you next year.
As you know, we have leaders from the BioHealth Capital Region welcoming all of our 1,000 registrants to the 7th Annual BioHealth Capital Region Forum. And we have our southernmost partner joining us now from Virginia. And we have Secretary of Health and Human Resources, Dr. Daniel Kerry, who's going to give some welcoming remarks from the state of Virginia. And Dr. Kerry was appointed Secretary of Health and Human Resources by Governor Ralph Northam in January 2018. And prior to his appointment, he worked as a cardiologist and served as Senior Vice President and Chief Medical Officer at Centra. Dr. Kerry, welcome to the forum.
Well, thank you so much, Richard. I really appreciate this opportunity, and good morning. It is my pleasure to welcome you all alongside many esteemed colleagues to the 2021 BioHealth Capital Regional Forum. As you may be aware, Virginia has over 2,000 life sciences companies and entities which contribute over $8 billion to the Virginia economy. These companies include all facets of bioscience: therapeutics, pharmaceuticals, diagnostics, medical devices, and even vaccines. Here in Virginia, we have cited the life sciences industry as a key sector of our economy, and we work hard to support it through direct investment into our companies. Today, you will hear from several Virginia companies and entities on panels highlighting our activities in the region, from Flow, discussing advancements in advanced biopharmaceutical manufacturing, to Ampel Biosolutions, discussing the use of AI in developing autoimmune therapies, and many other innovative Virginia voices. The participants on these panels truly exemplify Governor Northam's vision of advancing life sciences throughout the Commonwealth as a means of addressing unmet medical needs to improve human health while creating high-quality, high-paying jobs. We are proud to be a member of the BioHealth Capital Region, and we firmly believe that this region can and will be in the top 3 biohealth clusters in the nation by 2023. Thank you all for all you do to make Virginia, the nation, and the world a healthier and safer place. It's been an honor to join you today and to formally welcome you to this year's BioHealth Capital Region Forum. Have a great meeting.
As we continue with the welcomes from the leaders from the BioHealth Capital Region, we have a strong leader who is a supporter of the biohealth industry as it serves as the epicenter in this region for many of the key biohealth federal and industry entities. County Executive Mark Elrick was elected as the Montgomery County Executive on November 6, 2018. He had previously served 3 terms on the Montgomery County Council as an at-large member, being first elected in 2006. He also served as a council member on the Tacoma Park City Council from 1987 to 2006. Please welcome County Executive Mark Elrick, a strong believer and supporter of the BioHealth Capital Region and our industry.
Good morning. Welcome to Montgomery County, the epicenter of BioHealth in the Capital Region. In the past, I would have been able to personally welcome you to this forum at the AstraZeneca R&D facility near Gaithersburg. I hope next year we can meet again in person. We were close this year. We didn't quite get there. This will be a large part due to the experts we have here in Montgomery County. Novavax and GSK's U.S. vaccine operations are headquartered here. We're also home to Horizon Therapeutics, United Therapeutics, QIAGEN, BioNTech, MS, Maxim Biomedical, and dozens of other industry leaders battling COVID-19. I'm looking forward especially to Dr. Fauci's remarks tomorrow. He and his hardworking team are also based in our county, along with others at FDA, our National Institute of Standards and Technology, Walter Reed, and the Uniformed Services University of Health. They all call Montgomery County home. These innovators and many others working not only on COVID, but also on cell and gene therapies and other biohealth technologies have helped propel the BioHealth Capital Region up in the national rankings, as you'll hear from Alex later this morning. And recently, we were selected as the location for the Global Pandemic Prevention and Biodefense Center at 2501 Twin Brook Parkway, and they've released their strategic plan only this Wednesday. There is no other area in our nation or world that is such a nexus of expertise from both the private and government sectors. And we don't just take our biohealth industry seriously. Our residents respect and value the science behind this industry. That is how, while we were the first in Maryland to be hit with COVID, and we were hit hard, we have been able to contain and recover more quickly than any of the other regions. In fact, Montgomery County has vaccinated more of its citizens than any other jurisdiction with a population of 300,000 or more in the country. I see Senator Van Hollen is speaking later today. We are grateful for the federal support we've received here in the county, more than $5.5 billion toward warp speed and other COVID-related R&D. And almost $400 million from the CARES and American Rescue Plan have been used to support our restaurants and small businesses, our citizens who've lost jobs, and residents who are struggling to pay rent. None of us want to see a pandemic like this again, and that's why we're excited to be part of Connected DMV activity. And you'll hear about that from Stu Solomon and Dr. Crow tomorrow. The Global Pandemic Prevention Center will be located here in Montgomery County. We have the knowledge, public and private investment, and location possibilities for federal, academic, industry, and innovation centers to grow in this county. And as you'll see in the Shear and Alexandria real estate equity presentations, our lab space is more affordable than the other top clusters, and we have a great quality of life to offer as well: schools, parks, and other amenities. You can't grow without a workforce. Montgomery County's workforce is one of the most diverse and highly educated in the country. To expand our ability to meet industry needs, I recently formed an MOU with the county, the University of Maryland system, Montgomery College, so that we can proactively work together on these issues. Tomorrow, you'll hear from speakers involved in this: AstraZeneca's Joe Sanchez and UMB President Jarrell. We appreciate their commitment to help us with career paths, training, and recommendations for job-ready workforce. So we have a lot happening in Montgomery County, and we're proud to be part of the BioHealth Capital Region. We invite you, whether you are in the region seeking to expand or across the country or overseas, to learn more about how you can join us. Feel free to reach out to my office or our partners at MCEDC to learn how you can grow your biohealth business here. And thank you, BHI and all the sponsors, for hosting this conference and the opportunity to welcome all of you to Montgomery County and the BioHealth Capital Region. Welcome and have a great conference.